In this episode of the Huberman Lab podcast, Dr. Andrew Huberman welcomes Dr. Layne Norton, a prominent figure in the fields of nutrition and exercise science. Norton, who holds a PhD in nutritional sciences and biochemistry, is known for his evidence-based approach to fitness and nutrition. The discussion covers a wide range of topics, including the nature of evidence in nutrition, the role of sugar and artificial sweeteners, the importance of protein, and the impact of resistance training, and the use of GLP-1 agonists for weight management. The conversation begins with Huberman asking Norton to clarify his stance on what constitutes reliable evidence in nutrition. Norton explains that while all observations can be considered evidence, the quality of that evidence varies significantly. He categorizes evidence into different levels, emphasizing the importance of randomized controlled trials as the gold standard for establishing causation. However, he acknowledges the limitations of randomized controlled trials, particularly in nutrition, where long-term studies are challenging to conduct. Norton highlights the need for a nuanced understanding of evidence, particularly in the context of nutrition, where many factors can influence outcomes. He stresses that while individual studies can provide insights, it is essential to look at the broader consensus across multiple studies to draw meaningful conclusions. This approach allows for a more comprehensive understanding of how various dietary components affect health. The discussion shifts to sugar and its impact on health. Norton addresses the common perception that sugar is inherently harmful. He points out that while excessive sugar consumption is linked to various health issues, the context in which sugar is consumed matters significantly. He references studies that show no difference in fat loss between high sugar and low sugar diets when total caloric intake is controlled. This suggests that the overall quality of the diet and caloric balance are more critical than the presence of sugar alone. Huberman and Norton also delve into the topic of artificial sweeteners. Norton explains that while there are concerns about the potential negative effects of artificial sweeteners on appetite and metabolism, the evidence is not conclusive. He cites studies showing that replacing sugary beverages with diet drinks can lead to weight loss and improved metabolic health. The key takeaway is that for individuals struggling with weight management, artificial sweeteners can serve as a useful tool to reduce caloric intake without sacrificing the enjoyment of sweet flavors. A significant portion of the conversation focuses on protein and its importance in the diet. Norton emphasizes that adequate protein intake is crucial for muscle repair, growth, and overall health. He recommends a target of approximately 1 gram of protein per pound of body weight for those looking to build or maintain muscle mass. This recommendation applies to both men and women, regardless of their fitness goals. Norton discusses the different sources of protein, highlighting the importance of high-quality protein sources such as lean meats, dairy, and plant-based proteins. He also addresses the misconception that collagen protein is an effective source for muscle building, clarifying that while collagen has its benefits, it is not as effective as other protein sources in stimulating muscle protein synthesis. The conversation also touches on the timing of protein intake. Norton suggests that while it is beneficial to consume protein throughout the day, the total daily intake is more important than the specific timing of meals. He encourages individuals to focus on meeting their overall protein needs rather than stressing about the exact timing of their protein consumption. Norton and Huberman discuss the critical role of resistance training in promoting health and longevity. Norton emphasizes that resistance training is not just for bodybuilders or athletes. It is essential for everyone, especially as they age. He explains that resistance training helps maintain muscle mass, improves metabolic health, and reduces the risk of chronic diseases. The conversation explores the concept of training to failure versus leaving repetitions in reserve. Norton explains that while training to failure can be beneficial for hypertrophy, it may not be necessary for strength gains. He suggests that individuals can achieve significant strength improvements by stopping a few reps shy of failure, allowing for better recovery and performance in subsequent workouts. Norton also addresses the importance of consistency in training. He encourages individuals to find a training routine that they enjoy and can stick to over the long term. This approach is crucial for achieving sustainable results and maintaining overall health. The discussion shifts to GLP-1 agonists, a class of medications that have gained attention for their role in weight management. Norton explains that these medications work by mimicking the effects of GLP-1, a hormone that regulates appetite and glucose metabolism. He highlights the potential benefits of GLP-1 agonists for individuals struggling with obesity, noting that they can help reduce appetite and promote weight loss. Norton emphasizes that while GLP-1 agonists can be effective tools for weight management, they should be used in conjunction with lifestyle changes, including diet and exercise. He cautions against viewing these medications as a quick fix, stressing the importance of adopting healthy habits for long-term success. As the conversation comes to a close, Norton shares his insights on recovery strategies for optimizing performance and health. He emphasizes the significance of sleep, nutrition, and stress management in the recovery process. Norton encourages individuals to prioritize quality sleep, as it plays a vital role in muscle recovery and overall well-being. He also discusses the importance of nutrition in recovery, highlighting the need for adequate protein and carbohydrates to support muscle repair and glycogen replenishment. Norton suggests that individuals should focus on consuming a balanced diet rich in whole foods to promote optimal recovery. In addition to sleep and nutrition, Norton emphasizes the value of stress management techniques, such as mindfulness and relaxation exercises. He believes that managing stress is crucial for overall health and can significantly impact recovery and performance.